people of internet, welcome to my YouTube channel. Thank you guys for clicking on this video. You've been amazing. For my subscribers, you've been amazing. Thank you so much for your support. I really appreciate it. And for the new subscribers, thank you so much for subscribing on my YouTube channel. You're amazing, and I truly love you all. And for the ones who have not subscribed, please make sure you subscribe, hit the notification bell, and comment on the comment section down below. And let me know, what do you want me to shoot about? What do you want me to talk about? Okay, what do you want me to improve on? Because I'm still new, I'm still learning a lot of things. So don't shy off. Please make sure you comment, okay? So for my new subscribers, my name is Frida. I'm from Kenya. I live in England. I live in Bournemouth, England. I work for NHS, and I'm a mother of one. I'm a mother of one. So if you don't want to call me Frida, call me Mama Ree. I love it. Mama Ree. Ree is my son. Okay, guys. So let's get into this video. After doing your IELTS and CBT, what's next when you come to this country? You'll be working as a pre-registered nurse until you do your OSCE exam. You'll be working as a pre-registered nurse as a band 4 before you do your OSCE test. And I get many questions. Many people ask me, how long will it take you to do your OSCE when you get in the UK? It will depend with the trust. Some trusts take up to 3 months. Others you can do it even within like 2 months. Others you can do it even within 1 month. It all depends with the trust. So guys, OSCE is a bit tricky, very tricky. But it's more of the things that we do, like we used to do back home, but here they do it differently. So you need to learn and you need to practice a lot. Okay, so what is OSCE? For the people who don't know, OSCE is an objective structured clinical examination. It's more of practicals. Like in Kenya, we used to do most of the placements. Like in the placement, we used to do assessments where the tutor will come and assess you. You do a procedure when they are watching. It's like that. That's how they call it here, OSCE. It's more of the same. Someone will be watching you when you do a procedure. Okay, I came in June, 3rd of June, but I was in the quarantine for 10 days. So we didn't start the OSCE training immediately, so we delayed a bit because of some trust deduction. So I did my OSCE on 2nd of August. I did it at Oxford Brookes. So you can do your OSCE at Ulster, Northampton, or Oxford Brookes. So I did my OSCE in Oxford Brookes. Many people say that Oxford Brookes, the pass rate is very low. I don't know about that, but so pass your OSCE on first attempt. I did it in Oxford Brookes. I did it in Oxford Brookes, and I passed it on my first attempt. I'm going to take you through what I did to pass my OSCE on my first attempt. After practicing it for a couple of sections. I had OSCE sections every week, like 2 days of OSCE. Yes. And my trust offers the OSCE training, so I didn't have to go through a lot to get the OSCE training from outside. My trust offers the OSCE training. Yes, and our educators are awesome. So guys, so I'm just going to share with you the basic things that you need to know about OSCE. You have a lot of procedures to do. In the OSCE, you have assessment, you have planning, you have implementation, and you have evaluation. This is a must do. You must do these four sections: API, They call it API: assessment, planning, implementation, and evaluation. And then you do 2 clinical skills. These clinical skills involves aseptic technique. You can do a catheter removal. You can do MS. That is a midstream sample urine. You can do a catheter sample urine. You can do a NG tube insertion. You can do a VIP score, IV flash. You can do a Braden score. There's a lot of skills that they can choose. Like they just randomly choose and you do it. So you do the API, and then you do 2 clinical skills. So for all these API and clinical skills, they are always basic things and things to do. In all this, you have to do them in every section so that you can pass your OSCE. And one thing you should also do is that if you should check the website, if you've been booked to do your OSCE in Northampton, Ulster, or Oxford, check the website, check their marking criteria. Make sure you follow their marking criteria. Make sure you follow their procedure, because this is what they will use to check what you're doing. They will use this marking criteria on their website. Make sure you have a look on that. When you're doing your practicals, when you're doing your practice before you do your exam, make sure you go through that marking criteria on the website. Okay, do that, and it will really help you, because you'll not miss a thing. If it's assessment, check on what their marking criteria, check every clinical skill, their marking criteria, what they are looking for. Make sure you have a look on that so that you can pass your OSCE. Okay, there is a lot of information about OSCE on YouTube, a lot of it, but what I can say is that make sure you check on their website to see the marking criteria. Northampton, I'm very sure they have their website. Ulster, Oxford, Brooks, they have their website where you can access. You're able to access the marking criteria. You're able to see the marking criteria and every material that you need for OSCE revision. You can check it online. So one thing I'm going to tell you is that before you do any procedure, you have to assess the scene safety. Is the scene safe for you and for your patient? If the scene is not safe, make the scene safe for you and for your patient, and then provide privacy for your patient. Provide privacy for your patient by drawing the curtains, maybe locking the door, doing anything that will provide the privacy for the patient to maintain their dignity. That's the number one thing. For every procedure, remember to assess the scene safety, maintain the privacy, maintain the privacy for the patient, to maintain their dignity. And then the second thing, you have to clean your hands according to rule. If you're using the gel, make sure you gel your hands, clean them according to the rule. All the procedures that you have to do, make sure that you know you don't skip any step of hand hygiene. Make sure you do it, practice it. Wash your hands according to and then the next thing is introduce yourself. Hello, my name is Frida. I'm your nurse today. What can I call you, please? And ask the patient what they would love to be called. Because I notice here, like, my name is Frida McKenna, but I have another name I would love people to call me. Call me Brianna. That, that's not my real name, but that's what I want people to call me. So ask your patient what they would love to be called. When you introduce yourself, my name is Frida McKenna. I'm your nurse for today. What would you love me to call you? And they'll tell you, I would love you to call me Brianna, or I would love you to call me Frida, or I would love you to call me Mama Marie, whichever, okay? And then after doing the introduction, check the ID, do the identity check for your patient. Patients have the wristbands. Make sure you check the wristband. And on the wristband, what are you looking for? You're looking for the name, you're looking for the hospital number, and you're also looking for the date of birth. And then you compare it with the documents that you have. If you're doing assessment, you have an assessment document, assessment form, or whichever document, it has patient details up there. So you check that, and then you ask the patient, what's your full name, please? They'll say, my full name is Frida McKenna, and they'll confirm with the assessment that is Frida McKenna, and the wristband is Frida McKenna. And then, what's your date of birth, please? They'll say 17th of July 1995. I'll confirm that with the wristband, and I'll confirm it with the form that I have to make sure that I have the right patient. Okay, and then after that, after doing all that, you have to ask, you have to check the allergies. Ask the patient if they're allergic to anything. Ask the patient, are you allergic to anything? And then the patient will tell you, maybe, yes, I'm allergic to penicillin. And then you have to ask the patient what happens when they take penicillin, or when maybe they take fish, or when they take anything that they are allergic to. Ask them what happens, and then maybe they'll tell you that it's anaphylaxis. You have to note that down, and then they will have a red wristband. They will have a red wristband, and then check on the wristband if it's written, like if it's correctly written, like this patient is allergic to penicillin. According to what patient said, they're allergic to penicillin, it should be written on the wristband. And if the patient doesn't have the wristband, make sure you get a wristband, that allergic pad. It's red in color. Make sure they have it on there. Get one for your patient, okay? And then after this, ask the patient, are they comfortable? Are they in pain? Okay, oh sorry. And then after the allergy thing, reassure the patient that you're not going to give them anything that contains penicillin, or anything that contains whichever drug they're allergic to. Just reassuring the patient and making them know that you're not going to give anything that has penicillin in it. Okay, and then after that, ask the patient, are they comfortable? Are they in pain? And if they're in pain, ask the patient to score the pain from a scale of 0 being no pain and 10 being the worst pain. How can they scale the pain? And they'll say maybe 5 out of 10. And then ask the patient, where is the pain? And maybe they'll say they have a headache, maybe they have a stomach ache, whichever pain they'll say. And then ask them, do they need some paracetamol? Do they need some pain relief for it? They'll say maybe they need it. Others will say, I had it maybe a few minutes ago. So yeah, and if they didn't have any painkillers, just let them know. You're going to check the drug chart after what brought you there. You're going to check the drug chart and see if they have any pain relief medication in it, and then you administer it to them after you're done with your procedure. Okay, so and then after that, make sure you explain to the patient why you were there. Okay, you've asked the patient their allergies, you've done your introduction, you've done your identity checks, safety checks, everything. So explain to the patient, gain consent, and explain to the patient why you're there. So hello, so I've come here to do a set of observations on you, or maybe I've come to remove a catheter, or maybe I've come to clean your wound, maybe I've come to insert a nasogastric tube, and then explain the procedure to the patient and gain consent, and make sure you explain the procedure, so that patient can know if they are comfortable, if they can accept you to continue to do with the procedure. Do you understand what I mean? So you need to explain the procedure to the patient, and then you need to gain consent, and then you continue with the procedure. So be clear in whatever you're doing, be confident, be clear, and when you're communicating, be very clear. Explain what you're going to do, why you're there, I've come to do a set of observations on you, maybe your blood pressure. I'm going to check your temperature. I'm going to check your oxygen saturations. I'm going to check your I said blood pressure. I'm going to check your pulse rate, your respirations. Maybe I'm going to do a neurological assessment on you, you know, just explain a bit for the patient. The patient will be okay, that's fine, you know. Yeah, those are the key things you always need to remember when you're doing any kind of procedure. Remember to check the scene safety. That is number one. Scene safety, provide the privacy for the patient to maintain their dignity. Number two, you make sure you clean your hands according to rule. Don't miss any steps. Don't miss. And remember all the 5 moments of hand hygiene: before you come into contact with the patient, after coming into contact with the patient, before, like after fluids, all those things, like everything. After you do something, after you touch anything, hand hygiene, make sure you do it. Hand hygiene is that don't forget to do your hand hygiene. And then after that, you introduce yourself into your patient, do an identity check for the patient, ask the patient if they are allergic to anything, and then explain why you're there and gain consent before you continue. And always remember hand hygiene. Hand hygiene. If you touch anything, gel your hands and make sure you clean your hands. Hand hygiene is everywhere. Don't forget to check the marking criteria on the website of the center that you're taking your exam from. Okay, so on planning and evaluation that is written, you'll be given 15 minutes and you'll be just writing it. But for those other procedures, always remember to those key things that I've told you about. And then after the procedure, make sure you thank the patient, say thank you, make the patient comfortable. Yes, and that's it. And in OSCE, documentation is everything. Pay key attention on documenting. Documentation is everything. Make sure you write your name. Make sure you can fail OSCE even when you miss a date, or when you miss time, or when you miss your initials, you can fail OSCE. Documentation is everything. At least when you're doing it, make sure you have 1 full minute to go through your documentation. That's what I did. Go through your documentation again and again and again. And then when you're doing your drugs, that is implementation, make sure you do some things like identity check. If you forget to do the second identity check for the patient, you'll fail the OSCE, because in implementation you have 2 sections almost every test, but you have to do those all things I've told you about: scene safety, maintaining privacy for the patient, cleaning your hands, checking the identity for the patient, checking the allergies, getting the consent and telling the patient you're there to give them the tablet. Make sure the patient is seated up so that they can be able to have their tablet, so that you can avoid aspiration. Make sure that you don't give anything that patient is allergic to. Make sure you go through the chart and check if the chart is complete. It has doctor's signature in it, it has a blip number in it, it has a correct dosage. And if you don't know about dosages, if you're not sure about any dosage, please make sure you confirm it with the BNF there. Make sure you know what's if the drug you're giving, well, like the mode of action, what are the side effects, okay? And then when you're giving the blood pressure medication, always remember to ask for the blood pressure. Like, make sure the blood pressure is is not low before you give your blood pressure medications. If you're giving some like bisoprolol, you also need to check the blood pressure, and you also need to check heart rate of the patient. So yeah, remember this small things can really make you go back and do that test again. And the second identity check is whereby after you've explained to the patient, because now you go back and prepare yourself, and then come back. You need to confirm again that you have follow those right patients. You're doing the identity check to make sure that you have the right patients. You have, and then you're checking your drug charts to make sure that you have the right routes, the right dose, right patient. It's on the right time. Which other rights is it? You check. Okay, so guys, OSCE, it needs you to be very confident. Practice. It needs you to practice, because you it's not easy doing this exam, because someone is looking at you like doing all these things, so just be a little bit confident, and you make it. Just practice, and more practice makes perfect. Practice, and you'll pass your OSCE first attempt. Do all these things. Check on the website, check the marking criteria, make sure you don't miss anything on their marking criteria, and you'll be ready to go. Okay, so guys, thank you so much for watching this video. Thank you for clicking on this video and watching it. Please subscribe, share it with your friends. I hope it was helpful, and if you need to know something like more about it, just comment, and I'll comment and ask me any question, and I'll be able to respond to you. You've been awesome, guys. Kisses and kisses. I wish you best of luck for the ones who are preparing for OSCE. I wish you all the best. Please remember to check the website for the marking criteria, and remember to practice. Okay, practice makes perfect. Okay, everything is on the website. Check on the website, check what they need you to do. Check. Okay, I wish you luck, guys. Bye.